Turning now to our Wellness Wednesday segment. Sepsis is the body's extreme response to an infection and sends 1.7 million Americans to the hospital every year. Nearly 350,000 people die or are sent to hospice because of this life-threatening medical emergency.
And because sepsis happens when an active infection triggers a chain reaction throughout your body, it's critical to recognize sepsis so you can get treatment quickly. September is also Sepsis Awareness Month. Joining us today is SSM Health's Denise Matana, clinical nurse specialist. Thank you so much for being here.
Thank you for having me.
So we're talking about sepsis today. What is it? What do people need to know about it?
Well, as you mentioned, sepsis is a whole body response to an infection. Normally infections are localized, but in sepsis, this infection becomes systemic, meaning it spreads throughout the body. So recognizing illness. So if you can remember the mnemonic time. So temperature, so fever is greater than 100.4 or greater. I would be infection. So if you know you have an infection or you think you have an infection, would be something to be aware of. M is change in mentation, so confusion or wanting to sleep all the time. And then E for extreme illness, so body aches, the heart is racing, difficulty breathing. Those would be signs and symptoms that you need to seek treatment for.
Any other kind of symptoms that we should be looking out for?
Those would be the big ones.
Okay.
Yes.
Okay.
Is this something that can affect everyone, or is there a certain age group that's more prone to being septic?
Sepsis can affect anybody. It's more likely to affect elderly and very young, so 65 and greater, and infants.
And what are the common causes of sepsis?
The biggest cause is bacterial, but can be caused by also a virus.
Okay. And anyone can get it?
Anybody can get it.
Yeah.
Anyone can get it. So if someone notices those symptoms, that time mnemonic you mentioned, they go to their healthcare provider. What are the next steps? How do you start to treat this?
So response there would be go to an emergency department and not to your doctor, but go to an emergency department, and there we would evaluate, and then the treatment there is going to be that we'll be doing diagnostic studies and then IV fluids and antibiotics if we determine that sepsis is likely.
And so you should seek treatment when you have all of those parameters met. Okay.
Correct.
And an incredibly serious condition.
Yes.
And what would you say to people at home who, there are a lot of people who have concerns about going to the doctor or don't want to seek treatment, think, oh, maybe I'm overreacting. What would you say to that?
So the best way to sort that out is to let the professionals sort that out. It's really hard. It's just like having a heart attack. We want to be able to minimize it and say it's due to something else. So really just letting those that know what to do sort this out to determine if sepsis is likely.
And don't ever feel silly about going,
No.
and it's actually better to get news of you're okay.
Right,
So,
exactly.
okay, well thank you so much for being here. An important topic today.
Thank you.